Thank you very much, Dr. Tedros, for sharing with us your thoughts and the work and on the future of the organization, with concentrating on our region, the region of Europe. This region is indeed very committed to global health and to the leading role of the WHO, and has always contributed to all developments in WHO at all levels. And I'm sure there will be a number of comments and questions from the delegations to you, dear Director General. So I now would like to ask you to raise your nameplates in order to see if you would like to intervene. So if you have any comments or if you have any questions about the Director General's speech, then please do so. I would like to remind you that we would like to have a break, a coffee break at 10 o'clock, so we have 30 minutes for the interventions. So I'd like to ask you to speak for 3 minutes each. Okay, thank you so much. So I would like to ask Estonia to speak also on behalf of the European Union. Thank you.
Thank you. Indeed, Estonia is taking again the floor on behalf of the EU and its member states. Director General, Excellencies, colleagues, dear DG, it is an honor to have you here with us in Budapest. Upon your election, we promised to always listen to you, and thus it is a pleasure that you in turn have come here to listen to us. We welcome the drive with which you have assumed office. Truly, you have hit the ground running and have set about steadfastly working to maintain and strengthen WHO's role as the global leader on health issues. In May, we called upon you to work on sustainable financing, transparency, priority setting, accountability, and alignment across the 3 levels of the organization. We note with appreciation that these aspects are reflected in the concept note on GPW that you have put forward. To build upon this promising foundation, we would like to highlight the following. We underline WHO's mission as a health organization, with not just disease on the agenda. WHO needs to focus also on prevention and promotion, not only on treatment and response. We also emphasize a stronger focus on cross-cutting issues, including human rights, right of everyone to the enjoyment of the highest attainable standard of physical and mental health, and gender issues. While enjoying the magnificent young talents of Budapest last night, our brains continued to reflect also on the debate of GPW that we had late in the afternoon yesterday, and therefore just a few words to continue with the GPW debate. We support the extraordinary executive board session in November that is in the planning, and we would like to use the session to discuss GPW only. In the upcoming consultations and meetings on GPW, we would appreciate having a systematic presentation on what will change in relation to the present work of the organization. And with that, I conclude this short statement on behalf of EU and its member states, and assure you of our continued constructive participation in the future debates on GPW as well as on other issues. Thank you.
Thank you so much. Maybe I shouldn't have mentioned the coffee and the coffee break, because I only see Kazakhstan who would like to intervene. So now I give the floor to Kazakhstan.
Distinguished Director General, distinguished Regional Director, dear colleagues, let me on behalf of Kazakhstan delegation to thank Dr. Tedros Ghebreyesus for your address to the regional committee participants. We all understand and share the importance of the Sustainable Development Goals. There are many issues and challenges related to the achievement of Sustainable Goal 3. According to the WHO data, there are top 10 causes of death in 2015 that are responsible for 56.4 million death cases worldwide, among of which are ischemic heart disease and stroke, chronic obstructive pulmonary disease, diabetes, tuberculosis, road injuries, and others. There is still a room to do more in order to substantially decrease the death cases. Kazakhstan supports WHO initiatives to prevent and protect population health. We believe that only if there is political support on high level, many things can be done and achieved. Our President, Nursultan Nazarbayev, supports and emphasizes the importance of public health actions and effective development of healthcare system. As an indication of the high-level support in Kazakhstan, the President of Kazakhstan plans to participate in the upcoming 40th anniversary of Almaty Declaration on Primary Care in October 2018 to be held in Almaty. Dear colleagues, we strongly believe that only when all interested parties are involved in health prevention and protection, all interested parties share the same vision, intersectoral approach is widely used, proper financing is given, and human resources are well prepared, we can achieve the set goals. Thank you for your attention.
Thank you very much. And now I would like to give the floor to our Director General so that he can respond and reply or react. Oh, I'm sorry. Oh, then I'm sorry, I couldn't see that. Israel. So Israel, please, you have the floor. I'm sorry.
Okay, thank you very much, Chair. Dear WHO Director General, we would like first of all to congratulate you and wish you success in your challenging work you are facing. We would also like to thank Dr. Susanna Jacob for her vision and leadership to advance the European region to continuous improvement. The priorities of WHO are according to the needs of the countries of the region with reference to the SDGs. We believe that universal health coverage, strong community health system, and well-organized public health services are the basics for improving population health. However, we see the world changing in front of our eyes due to new technologies not only in the health sector. Issues such as big data, telemedicine, and development of new devices and communication networks may change the roles of health professionals. In the near future, we will be able to prevent, diagnose, and even treat patients by application of these modern devices while changing the traditional processes. For example, we can envision European medicine supports health system in other areas to improve population's health and treat patients by telemedicine and other applications. Complicated patients may be treated at home instead of in hospitals. These developments have many advantages but also challenges. The new technologies may improve to access the healthcare of certain population in less developed regions, allows us to develop new prevention and early detection methods and lower the cost of healthcare. On the other hand, the same technologies calls for new regulations such as for privacy of data and even for new definitions of the health professionals. Another new challenge is, of course, the cyber threat. We must look forward and try to estimate the future changes of the health system. Israel believes that the WHO can serve as a leader both in the development and, even more important, to the response to the new era we are facing. We suggest looking on innovation and technology not as a tool, but as a strategic platform that should be part of setting future goals and priorities. Thank you.
Thank you so much. Now I look around once more in order to see if anybody would like to have the floor. And if no, then I now turn to our Director General. So if you could please reply and react to the interventions. You have the floor.
Yeah, thank you, Estonia, Kazakhstan, and Israel for your input. I know why you didn't want to take the floor today. Most of you have already given us excellent recommendations yesterday. So we have taken note of that, and I have taken note of today's interventions also. So we will improve our GPW based on your inputs. So thank you so much again. You have given me lots of opportunities. Yesterday's working lunch, and then time dedicated for GPW, and now third time actually. Very, very generous. So I thank you and Susanna for this opportunity. So thank you so much. Have a nice day. Thank you.
Thank you so much. Thank you for your speech and introduction from yesterday as well at the ministerial lunch, and thank you for today's speech as well.